Chair of the Senate Health and Human Services Committee, Senator David Hann, joined the governor at that bill signing earlier in the week. He joins me now to talk a little bit about it and about his health care compact idea. Thanks for joining us, Senator.
Good to be here.
Let's talk first about this bill signing. And again, it restores $18 million in funding for personal care assistance, emergency medical assistance programs, among others. Now, who do you think benefits the most from this legislation?
Well, I think there are a number of people that benefit. There are a lot of small issues that are covered in that bill that are doing some things. Some of them are reform-oriented. We've got some things that are trying to pilot new approaches to doing nursing home care and so forth. But the biggest issue and the strongest reason that we had to try to put this bill together was to deal with a rate cut that was in the last bill that was contingent upon a federal waiver showing up, and that federal waiver hasn't shown up yet. And so there was a group of care providers that were faced with about a 1.67% rate reduction. We felt that that was not doable to let that happen, so we really wanted to have a bill that would address that, and that was one of the key components of what we did in addition to the things that you mentioned.
Let's talk a little bit more broadly. In a release by the governor's office about that bill signing, it stated, quote, that it reflects a remarkable example of bipartisan negotiations on the part of the legislature and the administration. So, Senator, given areas of contention in healthcare between the two entities, what kind of message do you think it sends to Minnesotans that you were able to work together and collaborate on this?
Well, my own belief is that we work together and agree on more things than we disagree. There clearly are some pretty high-profile things that people differ on, but most of the work that we try to do in the legislature for the benefit of the people of the state, there is a lot of bipartisan effort to get these things done. In the health and human services area, there are a lot of things that people don't have ideological differences on. It's really a question of what can we afford to do and what is the best way to use the money in a way that is accountable to the public. So when you start with that premise where you don't have ideological differences about the need to try to help people who need assistance, it really comes down to more of the practical questions of how do you solve those problems. This year, because we did not have a budget issue to deal with, we weren't trying to figure out a big global budget, but we're really trying to address some very specific problems, and we had very limited resources available to us. I think there was an agreement on the ground rules going in, and it led to some very productive work, and we all tried to focus on what were the high priorities, and I think that happened.
I'm going to switch over to what you mentioned as a high-profile ideological difference. You led a successful effort in the Senate, and eventually it passed in both the House and Senate, asking Congress essentially for permission to establish a health care compact. And you've been saying that this compact is important. Why do you think it is?
Well, I think what it does is it sets the expectation or lays out the goal of restoring to states the authority to make decisions about health care dollars. That's the way that historically we've operated in this country. It's only been in the relatively recent few decades maybe that we've seen this erosion or this transfer of power to the federal government in decision making on health care. I don't believe that that experiment has been very productive, and just the whole way that we have to deal with Medicaid and the seeking waivers and trying to get permission to do things that we as a state think are right is evidence of that. So what the compact does is say that once the Congress approves, and they would have to approve, then the federal dollars that are being spent through the federal laws would be returned to the state to be spent under state law. And so it really returns the authority of state government to make decisions on health care dollars. And that's really where it should be, and I think it's more accountable to the public that way.
The governor did veto the bill.
Yes, he did.
There was a write-up in the New York Times about the issue, and it quoted Kate Johansson. She's the manager of health policy at the Minnesota Chamber of Commerce. And here's that quote. "This is a very toxic atmosphere between Republican legislators and the Dayton administration on this issue." Senator, in your opinion, have these philosophical differences essentially become toxic?
Well, I think in some ways they have, and I think what she was commenting on was really had to do with the healthcare exchange, and there's been some other wrangling about that issue. But what it comes down to is whether or not we believe that the federal government ought to be the major player in decision making on healthcare, or whether the states ought to be the major player. And we believe that it makes more sense, it's more fiscally responsible, and it's more responsive to the needs of citizens if you have decisions made by a state legislature. I think clearly, given what the governor's actions were in vetoing our health care compact bill, he doesn't share that belief. I think he has a high degree of confidence in the federal government being able to do this. The health care exchange is another one of the federal ideas that is being asked that we should be compelled to adopt, and there are many of us who don't believe that that makes any sense, that we ought to have ownership here in Minnesota about how we are going to manage health care and health insurance. And I think that is the ideological, if you will, or the philosophical divide that exists between the governor and where we are.
So given that, do you think there's any room for compromise with either yourself and those who follow your line of thinking on this issue and the governor's office?
Well, I think so, and I really believe that the results of the Supreme Court case that's going to come forward sometime this summer will be helpful. I believe that the Supreme Court will overturn at least major portions of the federal ACA, and as a result of that, I think it will reset the stage to ask the question again, where should decisions about health care be made? And I believe that as this issue becomes more broadly known, that the public is going to weigh in on this, and I can't believe that they will say we would rather have policy decisions made in Washington than in Minnesota. Just on the face of it, if you make a decision in Minnesota and it turns out not to work so well, you can change it. Now, it's always hard to get the legislature to change, but if you make that decision in Washington and you need to have the federal Congress change, that's a very, very difficult threshold to meet. So as a practical matter, we ought to be trying to focus more decision making at the state level than at the federal level. And I think that as people become aware of this, I think we'll have the support of the public.
Senator, the Times also stated that Minnesota is essentially a case study of the politics found in state capitals around the country as officials grapple with this health care insurance exchange idea. Do you think we have entered uncharted territory at this point?
Well, not really uncharted, but if you read American history, there have been a number of cases where there's been this tension and debate about what is the role of the federal government, what is the role of state government. And I think this is one of those times where we're being asked to think about this in a way that maybe we haven't. And it's a good thing to think about, and it's a good debate to have. It really calls into question whether the federal structure that was enacted by our founding fathers is legitimate, is workable, and is still applicable to today, or whether it isn't. I believe it is. I believe there's great merit in that, and I think that we need to continue to make the point that this is the way to restore that balance of power, is to make sure that states have the power and the ability to make decisions, and that there are some things, even if they may be good things, are simply not in the province of the federal government to decide. And healthcare is one of those things. Very personal issue, very costly issue, a lot of differences of opinion. It makes more sense to allow states to have the say in how to do that and give them an opportunity to experiment, and through that, I think you'll end up with better decisions and a better system overall.
Okay, Senator David Hann, thank you for your time on this issue. We appreciate it as always.
Thank you for letting me be here.